And good afternoon, everybody. It is April 15th, which generally would be tax day, but not this year. It's you have until May 15th to pay your taxes, but we have other things to consider today, and it's the weekly Nevada County vaccine update. And Ryan, you want to kick it off with where we are at, what's happening?
Sure. So we're just under 59,000 shots in arms in Nevada County. Last week it was 54,000 when we did this update. So we are continuing to vaccinate at a good clip. We're in a little bit of a lull in supply at the state level and nationwide due to the supply issues with Johnson & Johnson, which we can also talk about some other issues with Johnson & Johnson a little bit later, but it is expected that supply will tick up significantly in the coming weeks and months. And so we're definitely preparing for that, looking to draw down state resources and coordinate with our various providers so that we can keep pace with the demand and the supply ticks up. The vaccines are working and are exceedingly safe. When we had an uptick in cases a couple of weeks ago, very few of them were in people over the age of 65, which is where vaccination was the highest because they were among the earliest eligible. So that's evidence that the vaccines are working and that it's playing out in our local data. Another really critical example of that I'd like to call out today is our long-term care facilities. We had some absolutely heartbreaking outbreaks in long-term care facilities last year, where an exposure from outside resulted in cases really tearing through the residents and resulting in many illnesses and deaths. And fast forward to now, and almost all the residents are vaccinated. They were among the very first to be eligible, and exposures have continued to occur, but so far with no infections among residents. So the vaccines are effective and safe. There's evidence that we're seeing already in our data. And so I would just like to urge people, there are a lot of people that are still on the fence and waiting to see what's happening with the mRNA vaccines. And so far, the mRNA vaccines appear to be rock stars in this without severe side effects and with high effectiveness. And so if you've been vaccinated, talk to your friends and neighbors because people are getting sick of hearing from people like me that they should get vaccinated. So I think that's where I'll end. And then, yeah, any questions?
Okay, and Jill, what do you want to add besides the get vaccinated?
The first and foremost, I think the most important message to share, but maybe I'll just share a few things, updates in the MyTurn system for those who are able to utilize that, those with internet connectivity. I will also say that we locally and at the state level are still working on another alternative to that for people who don't have connectivity. But some great updates to that system. Second dose appointments are automatically canceled now. If somebody cancels their first dose appointment, that helps both us and others who don't have an obligation to go in and try and cancel a second dose appointment. They've simplified the age ranges into two groups. So now there's 16 to 17 and 18 plus. And then the other thing they did was they added a function to prevent patients who are under 18 from scheduling an appointment for a vaccine that is not open to their age group. So basically limiting 16 and 17-year-olds at this time to a Pfizer clinic. So those are some really great additions. And then I do want to celebrate the numbers like Ryan just shared. And Pascal, I know that you tap into the CDC's website as well. And the CDC does share the number of fully vaccinated people. I think the state, its dashboard will soon include similar information. But when I looked this morning, it indicated that just over 50% of our 65 and over population was vaccinated, and that's really exciting. And I think just over 27% of our 18 and over. I think once the state gets its dashboard up, they will include 16 and over since that is who is eligible in the state. But yeah, so exciting news. Like Ryan said, we're moving forward at a good clip. And some practical updates that are helping people schedule their appointments a little more accurately and a little more easily.
Yeah, the CDC has. I was very excited when I found that data on the CDC website where you can go look up, and so total population vaccinated in Nevada County is at 22,721, which is 22.8% of the total population. but that of course includes also the kids from 0 to 16, but 50.3% of the 65 and over are vaccinated, yay. And 27.4% of the 18 and older are vaccinated. And that is really great news, because, and it's going up, and it's now one of the things I do. I'll do twice a day, in the morning and then in the evening, because they actually update. I found out that they update the CDC site twice a day, so that's really great. And well, we then take that plus the total doses administered and the new cases from the county dashboard, and put that in Happening Now, because that's really it's really good information. And I'm very happy to say that all of you, Bennett, all 2 of us, are fully vaccinated, and it's great, and yay. And I can't wait for more people to get vaccinated, so that we can get back to what is considered normal before fire season kicks in, and then we'll switch gears to that. But got a couple questions ahead of today, and so they were mostly. So I live here in Nevada County, but I'm a member of a big health plan who's based outside the county where I also work. Should I plan on getting my vaccine from my health provider, or should I rely on Nevada County Public Health?
Well, he can sign up through MyTurn. I mean, it's really simple, and there are options for vaccination sites. I mean, we have both Docomo's and Whispering Pines, and we're finding not every provider is giving immunizations. So he may check with his provider if he is. That's a real simple option for them, but not every provider in Northern California is giving the COVID immunizations. So he should check with his provider and see, but sign up for MyTurn. He's going to need to do that anyway.
I think we like to say wherever you can get it first. That's the place where you should get it. And I know Dr. Kellermann and Dr. Trochet have been talking about this race against the variant. So we do want to encourage people to get vaccinated as early as possible.
And a companion question to that is, what is required for my daughter to get a vaccine? She's a minor and she lives with me here. That's a mom asking. So does, with the new MyTurn, do parents have to sign them up? Do they have to be present when the kids get vaccinated? How does it work?
Yeah, we strongly request the parent or the guardian to be there and sign a release for any minor. And that's our policy so far, is that the parent needs to be there at the time of immunization. And so if it's a minor, they may not be driving anyway, and how they're going to get there. So just come and make it a family experience. And if the parent is not immunized, we can give them a twofer. Both get immunized at the same time. It happened with my granddaughter and her mom. They came to Whispering Pines, and granddaughter had a little trepidation, but they both left with smiles. So that's what we're seeing, creation of smiles there at our clinics.
Yeah, I have to say there were a lot of smiles and fist pumps when every time I see anybody at Whispering Pines. It's people coming out. They have the smiles and then the yay. One question that I found a little surprising was, the person says, I started a new job and I don't have health insurance. I was told I had to have insurance to get a shot. I don't believe that's true.
No.
No.
If somebody is registering in MyTurn, it will collect your insurance information if you have insurance, but nobody should be charged for this vaccine.
Okay, I think that's very important to get that out. And then
there are some insurances, like Medi-Cal will pay for an administration fee, and that can be charged, but it is very, it's a very small amount. And if you don't have, these immunizations are free. will not cost you anything. If you don't have an insurance, don't worry. There should be not an impediment to being immunized is ability to pay.
And the next question here is, what are the current recommendations for gatherings, paid or friendly, with people who are all vaccinated?
I think we could put links to the guidance documents in the chat. I'm happy to share some highlights, and Dr. Kellermann and Ryan, please feel free to jump in, but some highlights from the state's guidance are that fully vaccinated people can spend time with other fully vaccinated people, including indoors, without wearing masks or social distancing. They can spend time with unvaccinated people from a single household who are at low risk for severe COVID, and they can do that indoors without wearing masks or social distancing. And they can refrain from quarantine and testing following a known exposure if they are asymptomatic. And that's outside the workplace setting. Workplace setting may influence that, but those are some of the highlights of what fully vaccinated people can do. Dr. Kellermann, Ryan,
Yeah,
you want to?
so there are freedoms available. I mean, we've had some little outbreaks and, you know, if been immunized, it wouldn't have happened. One of the other things, if you're immunized, as Joe mentioned, you don't have to quarantine except in certain circumstances. But you know, there's a lot of freedoms to being immunized. And Supreme Court ruled on indoor gatherings for spiritual reasons, and so you have opened that up more to home gatherings. Obviously, in a closed quarter and for ventilation, wear a mask, vaccinated or not. I mean, nobody knows. We don't have tattoos or anything like proof of being vaccinated, and so we ask you to still mask. And if you're sick, get tested. You know, it's not 100% effective. It's close, but not quite. So if you've had a previous infection, yeah, it helps prevent future infections for about 90 days and potentially longer, but certainly for 90 days. But if you have symptoms from previous infection, particularly 90 days out, get tested. If you have symptoms, been immunized, get tested. Because there are some breakthrough. It's pretty rare, but we are seeing it happening in our county.
And MyTurn this morning did not have any appointments for 95959, not for any location. What's happening?
Yeah. Friday at noon.
Yeah, our appointments are still filling up really quickly. So as Dr. Kellermann said, as close to that day and time as people can get in there to register, the better. There are cancellations from time to time, so appointments do open up during the week. That's less frequent. So yes, Friday at noon is the magical hour where you're probably going to have a pretty good chance of getting an appointment through the MyTurn system. And Pascal, I'm just gonna put in the chat because it said private or paid or friendly or paid, right? I just want to make sure that people know that the state did put out guidance about what fully vaccinated people can do. I'll try to find that link. And then they also put out guidance for outdoor events. And then just yesterday, they posted guidance for indoor live performances and also a guidance for private events that are indoor. And so that you do have to wade through a few pages, but you can get a sense of what the state is recommending and supported if one goes through those documents. And like I said, I'll try to I'll put all those links in the chat.
Yeah, and just to be clear, we are still, the tiers are still active. We are still in the red tier. And to get to the orange tier, which would be the next one, that would be, we would have to get the case count down to either to 2 to 5.9 daily cases per 100,000. So we're not quite there yet, but if everybody is getting immunized when they can, wearing the mask and keeping the social distancing, because like everybody says, vaccinated is great. It is the best protection we have. Is it 100%? Well, not always, but it is definitely something. What it definitely does is prevent you from getting on a ventilator or dying from it. So that's, that is definitely something. I'll take it over. I'll take that over a sore arm any day, and the sore arm goes away pretty fast. So no problem there. And for the MyTurn, yesterday we had media. We got a preview of the MyTurn, the new MyTurn, because they had a few. They have the additions, the new additions, and there are there were some things that changed, which was weird because now they actually ask more questions right from the get-go, so that basically when you come to your appointment, all that information is there. And so let me put the link if you want to look what it looks like. I'm going to put that link in the chat. It's a short YouTube video that CDPH put out yesterday, and they told us that as of today we can share it with people because it's no longer, it was on background, but now you can. So if you want to watch that, it's very fast. You'll see what you have to, the questions you have to answer, and then you can get your appointment, and especially Friday at noon. And for people who are not online, I think there is 211, and there's also a phone number on the MyTurn website where people who are not online who can go and get the help there to help them sign up, right?
Yes, there is. I'm just going to pull that up real quick. Oh,
okay, yeah.
I'll put that in the chat as well, Pascal. Or actually, will that work? You
Sure.
want to say
Yes.
it out loud?
Yes, you can here, wait, here is the
Here we go.
uh,
I got it. You ready?
yep.
So it's 1-833-422-4255. And I'll say it once more for people who are trying to write that down. It's 1-833-422-4255. And that number is good Monday through Friday, 8 a.m. to 8 p.m. and Saturday and Sunday, 8 a.m. to 5 p.m.
And here's a question that just came in. You just mentioned Saturday, Sunday. Is the county going to offer Saturday, Sunday clinics at Whispering Pines for people that work throughout the week?
We've talked about doing that, but we're also looking to bring in another resource that is supported by the state. So regardless of how we do it, we are trying to work to provide a weekend option for those who find it difficult to get to the test or to the vaccination clinic during the week. And as soon as we have that, we'll make sure that you all know, as soon as we have a weekend resource.
And
There are providers in our community. Dr. Hicks is with Ubidox is going to have a Saturday clinic. The hospital's been having Friday, Saturday clinics also, Sierra Nevada Hospital. So there are other options available, but we certainly think when age group moves down, or if they open up the 12 to 16 age group for the Pfizer, which looks like it's going to happen in the next 3 or 4 weeks, then it's hard, because that means a parent take away from job and the kid, is off of school. And we think some access to Saturday clinics will certainly be appropriate.
And thank you, Jill, for posting all the outdoor seated events, the indoor seated live events, and the events guidance. So then,
yeah,
that's all everything you need to read to figure out what the official guidance is, and then you have to make the call, because you may want to go to that one event that you really are looking forward to, but it's up to you to calculate your own risk, and if possible, err on the side of caution.
And Pascal, I should have put private events guidance on that one document. And I'm glad that you gave that it's sort of conditional, right? There's no environment that is going to be 100% safe. So yes, please take those calculated risks if you're taking risks.
Taking them, there is taking a chance, and then there's taking risks. So that's either or. It's totally up to you, and that's it is the you have the freedom to make mistakes. That's one way of, that's the one way that a friend of mine put it. It's like, oh, you always have the freedom to make mistakes, but maybe not. Maybe avoid it. Here is another question that came in, and I think we had it. We had that one. It came up a few, probably a few meetings ago. With the tier system going away, why should anybody follow any of the rules?
Yeah, it's good. I mean, that's a great question, but you may ask whoever the listener is or viewer is, why follow any rules? You know, and you mentioned bad decisions. They have consequences. I mean, do you want to get sick? You want to pass it on to the friends you love and you care for? These are not strict rules, they're guidelines and are subject to be broken. I mean, you don't have to go far in this community to see them being broken. But there's consequences to action, and that's those actions. And our numbers now are 8.1 per 100,000, solidly in the red tier. Last week is 12.7, solidly in the purple tier, and that's the reason we're percolating. But those are just numbers, and numbers are just numbers. But everybody, I mean, people I think in this community know people who have suffered from this disease, and that's the consequences of not following guidelines. Don't think you get a get out of jail card for free get out of jail card here in June 15th, because there's going to still be mask wearing, and you're still going to have to protect yourself. I mean, I looking at this virus, and I see the graphs, and knowing the virus doesn't know dates. It doesn't know boundaries. It doesn't know borders. So yeah, we're still going to be, COVID's going to be around after June 15th, and you still need to protect yourself. We hope to get herd immunity. But I think, looking at the numbers, we're probably not going to have herd immunity then. So even though there will be some opening, of the state, I think there's still going to be some guidelines that are going to be issued to keep not only you safe, but the people you're in contact with.
Yeah, the common sense health guidelines that the state so vaguely refers to. There's still not enough. There's really, well, again, on the call yesterday, they were asked about the what these common sense guidelines would be, and what would be if there was any if there would be any consequences or enforcement, and it's all still very vague, and personal responsibility was mentioned several times.
Oh, could I add? Well, first of all, if staying healthy and keeping others healthy doesn't appeal to you, which probably means you're not listening to this webcast, but let's say that doesn't matter. Like, the other thing is, this is like the third iteration of a stay-at-home order that the state has had. There was the original stay-at-home order in March of last year. There was the county monitoring list, referred to as the watch list, in the summertime. And then there was the blueprint for a safer economy. So I would say also, if you don't want to have a fourth iteration of a stay-at-home order come back at some point, it's important to not treat June 15th like it's a finish line. There was an article just this morning about rural communities with a lot of vaccine hesitancy potentially continuing to have COVID spreading for quite some time. And that can be an incubator for variants, which could potentially cause there to be an erosion of the protection of vaccines that would necessitate additional waves of shutdowns and things like that. So definitely, I would advise people not to see June 15th as the end of the road.
And not to mention the rural communities. We are a rural community, but then also keep in mind that one of our most important industry is tourism. So you will have people coming, and they don't just come from California, they come from all over the place because, hey, we live in a beautiful place. So the more it could be pure self-preservation. I mean, if you don't want to protect the community, maybe you want to protect your business, or maybe you want to protect your livelihood. So that's one other way. And here's a question for Dr. Kellermann. What is your opinion about former COVID patients only getting the first shot of Pfizer due to excess antibodies and thus adverse reactions to the second shot? And will they be considered vaccinated if they only get a first shot?
Well, it depends on how you define vaccination. Actually, there's some studies coming out of Europe that shows that whoever that asked the question is probably right. You probably do have a robust immunity. We had worried about for instance, the skilled nursing facilities and assisted living, because many of them are kind of immunocompromised. Your immunity goes down with age, and turns out quite a few of them had infections before, survived infections, then got immunized, and we're not seeing outbreaks, and we've seen exposures without outbreaks in these facilities. So at least in a personal experience, it shows that you are quite immune if you've had a previous infection, and certainly get vaccinated afterwards, even in those patients that we thought would not have a robust immunity. I think to answer the question, if you look at the British data, they're probably right. I wouldn't take a chance. You got 2 shots coming, might as well get it. Yeah, you might have a little more you might feel a little worse after your second shot, but I know I was meeting with a group of docs a while ago, and one doc said, man, I felt bad after my second shot, and another doc said, you're so lucky, because it just means you got a pretty good immune response, and that's really what you want. Yeah, I'm sorry you don't feel well for a day or so, but you can be pretty sure that your immunity is very robust after that.
And since you mentioned the UK, we have the now you confirmed that we have the what's called the UK variant, which is now which is at least since March in Nevada County, and probably since much earlier. So we know that there is the West Coast variant, and the UK variant have now been confirmed in Nevada County. And again, variants show up when the virus that's busy multiplying itself for a couple gazillion times a day makes a mistake, and then every once in a while one of the variants is smarter, and the UK variant, which is apparently way more infectious. It's the risk of infection there is greater than with the good old COVID-19 virus.
No, it's kind of a bad actor. Thankfully, it still responds to the monoclonal antibodies and remdesivir, and it can be a little more problematic for the people that get it, a little more virulent, and it's apparently up to 50% more contagious. We don't know why. It may have a little more virus in the system, may last a little longer. But yeah, it's not what you want. But the good news is they respond to immunizations. And as I said, we're getting down to close the hour. And in response to immunization, the state, our average is 22.8% of our county's been immunized. And Pascal, you're 4 times more than that. And you've been that. I want to thank you. You got 100% there. Score.
Yep, it's small and nimble. Sometimes it's an advantage. We are we have now it's 12:30. So as usual, I'm going to ask you for the parting words of wisdom from our 3 experts, please.
I'm just going to jump in and echo what Dr. Kellermann and Ryan were talking about earlier, and what one of the listeners asked. Please don't distort that June 15th date, and don't interpret it as everything is perfectly safe now. The whole time we've been asking people to take precautions to protect themselves, for them to protect their loved ones, and really to protect other people's loved ones. So you're protecting yourself, you're protecting your loved ones, you're protecting your community. We'll still ask you to do that up until that date. We certainly don't want to see things worsen. Yesterday, our dashboard reported 5 hospitalizations. Last week, we reported another death. So it's not over. It's getting better, and the vaccinations are helping us get to that end point. But again, hopefully people will continue to take those precautions to protect our loved ones, and to avoid the kind of impact and suffering that illness can have on individuals and families.
Ryan, anything?
Yeah, I'll just reiterate something I mentioned briefly earlier is, if you've been vaccinated, please talk to your friends and neighbors about it. Research has shown that, people who are hesitant, they're going to listen less to public health saying over and over again, get vaccinated, and more to their friends and neighbors. So if you're sitting out there wondering how we're going to get to our vaccine hesitant community, well, it's through you. You're the one that needs to get to them. So, so please be our advocates and encourage people to get vaccinated.
Thanks. I met with an older lady the other day, and she was kind of creaky sitting on the front porch, and she said, lived a lot of years, and I can identify with that. And she said, I got 3 things going for me. I got hindsight, I got a lot of that, and I got foresight, and I got insight. And, I've only been public health about 3.5 months, but my insights have been actually overflowing. So appreciate Jill and Ryan for shepherding me along the path. But I think, telling the folks that are listening, get immunized. It'll change your life and prevent you passing an infection on to the folks you love. It's certainly an act of charity and compassion. So thank you.
All right. Well, with that, thanks for being with us. Thank you to our 3 public health experts, because while we may not always listen to you, if you keep repeating it often enough, it's going to trickle into our brain, and then we can regurgitate it, and we can tell our friends, our families, and people who want to know what they should be doing. And hopefully by very soon we will all be maybe outside, and maybe one of these days we can have one of the last town hall, wouldn't it be the last webinar? Maybe we can have it in person. That would be that's the goal.
And Brian Evans said he would be buying Touch of the Bubbly for everybody.
Absolutely. Yeah. Okay, with that, bye everybody.
Thank you.